Today we'll be discussing operant conditioning and behavior modification. Behavior modification is significant because it encompasses many realms such as education, psychology, therapy, healthcare, the criminal justice field, and rehabilitation. Behavior modification is an effective intervention used to eliminate or reduce unwanted or maladaptive behaviors. Skinner is the founder of operant conditioning, which is a crucial part of behavior modification. Skinner expanded on John B. Watson's behaviorism. Operant conditioning is based on the belief that organisms can be influenced and guided by consequences. Skinner argued that learning occurs when behavior is either reinforced or punished. These are now the core principles in applied behavior analysis as well as behavior modification. The core principles of operant conditioning is reinforcement and punishment. Reinforcement is separated into positive and negative reinforcement. Positive reinforcement is simply when there is an added stimulus that will increase the likelihood of the behavior occurring in the future. An example of positive reinforcement would be giving a child candy after using the bathroom and the toilet. This would increase the likelihood of the child continuing to use the bathroom. In the other form of reinforcement, which is negative reinforcement is simply when a stimulus is removed to increase the likelihood of behavior occurring in the future. An example of negative reinforcement would be removing a non-preferred activity once a child begins working on the activity. This will increase the likelihood of the student attempting to complete the non-preferred task in the future. This example would obviously have to be monitored closely, though, to make sure that we are not maintaining an escape maintained behavior. There are various studies that indicate the effectiveness of reinforcement. A specific study conducted by Green and colleagues in 2022 examined reinforcement as a method of intervention to combat burnout amongst healthcare professionals. The study used a mixed methods approach, recruiting adults at Cedars-Sinai Medical Center working in the medical ICU. All participants were asked to complete a questionnaire before and after intervention. Positive reinforcement was the designated intervention. After the intervention, the data indicated that post-intervention, there was a trend for participants having greater teamwork attitudes and higher resiliency. This study demonstrated the effectiveness of deliberate reinforcement and the various fields operant conditioning can be effective. Before going further into operant conditioning, it is important to recognize that positive and negative when we're discussing operant conditioning does not necessarily mean good or bad. Positive should simply mean something is added, and negative simply means that something is removed. So when talking about punishment, there are two types of punishment, positive and negative punishment. Positive punishment is simply there's an added stimulus that will decrease the behavior in the future. An example of positive punishment would be scolding a student or even spanking a child. I included spanking a child as an example to prove the point that positive punishment does not necessarily mean that it is quote unquote good. It just means that there is something added. Negative punishment is when there is the removal of a stimulus that has the likelihood of decreasing the behavior occurring in the future. An example of negative punishment would be removing a toy when a child begins to engage in tantrum behavior. While more modern behavior modification using operant conditioning focuses on reinforcement procedures, there is an effectiveness in punishment procedures. A review article written by Dorothea Lerman in 2002 examined research in the effectiveness of punishment. There are 4 decades of research that have indicated the effectiveness of punishment and the reduction of maladaptive behaviors. Punishment procedures have shown to be effective, particularly when functional analysis of the maladaptive behaviors cannot be determined or controlled. But despite literature on the effectiveness of punishment, there's been a decline of research in more recent years. Therefore, it's vital that additional research be conducted. With many things, consistency is key. Particularly in operant conditioning, it is crucial to the effectiveness of treatment. If reinforcement is not consistent, then treatment will not be effective. To establish consistency in operant conditioning, there are different types of reinforcement schedules that are used. There are two main schedules of reinforcement. The first main schedule of reinforcement is continuous, which provides reinforcement after every time the desired response occurs. By doing so continuously, it establishes new behaviors or skills more quickly. The second type of reinforcement schedule is partial, also known as intermittent reinforcement, which provides reinforcement on a discontinuous schedule. This method effectively establishes greater resistance to extinction and a stronger behavior momentum. Intermittent schedules of reinforcement is further separated into variable and fixed schedules of reinforcement. There is fixed ratio reinforcement, which occurs when reinforcement is provided after a set number of responses, whereas fixed interval reinforcement occurs when reinforcement is provided after a specified period of time has elapsed. There is also variable interval reinforcement, which occurs when reinforcement is given after varying time intervals. And there is variable ratio reinforcement, which occurs when reinforcement is given after a varied or unpredictable number of responses occur. It's important when we are using intermittent schedules of reinforcement that we stick to one schedule of intermittent reinforcement for whatever the specified task is or skill that is being worked on, and not switching from variable ratio to variable interval and vice versa throughout all of the intermittent schedules. Sticking with one schedule of intermittent reinforcement is beneficial to treatment. As with any intervention, consistency and reliability is key. There are many common errors in the application of operant conditioning, one of which is reinforcing the person rather than the behavior. For attention-maintained behaviors, it is also common for teachers to inadvertently reinforce maladaptive behavior by labeling the behavior and providing attention. Continually in escape-maintained behaviors, adults can reinforce behaviors through negative reinforcement unintentionally by removing the aversive task. While removing the task is easier, it reinforces that tantrums or maladaptive behaviors can provide escape from the non-preferred task, which will therefore increase the likelihood of tantrums and maladaptive behaviors occurring in the future. This highlights the importance of incorporating other concepts in behavior modification outside of operant conditioning in order for the use of operant conditioning to be effective. There is an ethical concern of the overuse of punishment in operant conditioning. Specifically, the use of operant conditioning in institutional settings has been raised recently. There are many concerns related to any treatment and therapy which is shared with operant conditioning, the issues of voluntary participation, informed consent, anonymity, confidentiality, the potential for harm, and results of communication. There is much evidence to the short-term effects of operant conditioning. However, there is not much evidence to the long-term effects of operant conditioning, nor the progression. Inconsistency in treatment can also limit progression or cause harm if operant conditioning is used unethically, and incorrect treatment can also cause harm and worsen maladaptive behaviors. Since the long-term impact of operant conditioning is unclear, it would be beneficial to examine these impacts further. Further, as a provider in the field, I would like to explore more effective training in operant conditioning, specifically in the education system. That is where I spend much of my time as an RBT. Too often I see teachers and paraprofessionals practicing what they believe is operant conditioning, but in practice it is reinforcing a function-based behavior and increasing the occurrence of that behavior. Further, it would be beneficial to interview those who have received behavior modification interventions to understand their perspective regarding effectiveness as well as their ethical concerns.